Healthcare in this province is always a hot-button issue, even more so as the provincial election approaches. The BC Conservatives have introduced their healthcare plan, if elected, promising to implement what they call activity-based funding. Hospitals would, for example, receive funding based on when they treat patients for specific diagnoses and procedures versus the current model of providing base funding. Joining us to talk about this model is Jason Morris, a political science senior instructor at the University of Northern British Columbia. Jason, thanks for being here. First of all, the Conservative Party says this activity-based funding model, quote, incentivizes providers to be more efficient and treat as many patients as possible. What about concerns that would this actually lead to better care?
Hey, thanks for having me. It makes sense if you think of it on the face of it, that the more you do, the more you might get paid, like lawyers, accountants, and even doctors operate that way. But at the same time, we're talking about a very complex healthcare system, and it's sometimes hard to find out where you go to make things move along faster.
And what would this mean, for example? It's one thing to treat a lot of people, for example, at a major trauma center, Royal Columbian, Vancouver General, Surrey Memorial. But what about for rural and smaller hospitals that don't treat as large a volume of patients?
We know that where we live in BC, as in many other provinces, impacts the access to the services that you have. And some kind of blanket policy that says this is going to be here simply won't work. Any program would have to be tailored to what those places, what those hospitals are already able to provide with the diagnostic equipment, with the human resources like the nurses and the doctors and the beds to recover in it, and so on.
And is implementing activity-based funding, do you think, a realistic promise? And if so, how quickly could that switch happen? We're talking about a lot of change.
It would be a significant change. BC did a pilot project on this back in 2010, and wait for it, but the health services minister then was Kevin Falcon, and looked at this for emergency department times and kind of like getting a bonus if you met targets. And it was really hard to tell the impact this had. A little scholarly project found, not so much. And as well, just to roll it out would be such a significant change again when hospitals are used to getting a single all-purpose global budget. They're not used to, putting money in a meter and then taking the service from there.
And lastly, we appreciate your time. Many British Columbians, as we've heard, don't have a family doctor. Do you think activity-based funding would help address that at all?
I'd say that this initiative looks at doing the actual intervention. Maybe it's the surgery, and reforms to healthcare have got to back up to some fundamental issues, such as our first point of contact for care. If someone is lacking a family doctor, sure, there are urgent care centers and walk-in clinics, but effectively they don't have access. They're uninsured, and the parties on the campaign trail should be looking at these real basic but also important healthcare situations.
Jason Morris from the University of Northern British Columbia, we appreciate your time and your analysis. Cheers.
Thank you.